Hi class, this is Dr. Eisenman and I am your System Director for Human Blueprint, also called HMBP. And in this video, I'm going to introduce you to the system and let you know a little bit about what you can expect and take you on the 10,000 foot tour of your system and what kind of is going to be coming at you in the next 6 weeks. Blueprint is one of 4 systems that comprises what we refer to as a thread. And this is thread 1. There are 4 threads that students take in the first 18 months of their preclinical didactics. Thread 1 is going to take you through about mid-December. And this is going to focus on things that we refer to as foundational sciences. And this system, Human Blueprint, is going to be a lot of review for many of you. And it's going to encompass basic sciences that you likely were exposed at some level to in your undergraduate studies or in preparing for medical school admissions. What we're going to do is we're going to ramp up the speed and ramp up the clinical depth of that information. So this is going to force you to start to tweak your study skills quite a bit over the next 6 weeks. What worked in undergrad may no longer work for you here. And so this is where you'll start to tweak your study skills. Blueprint is about 6 weeks long. There's going to be 4 quizzes and 1 system exam. This is a comprehensive, cumulative exam. And along with that, we're going to have assessments tied to team-based learning. And this is a special session that you'll experience where you're going to be working as a group of 5, sometimes 4, sometimes 6. And you're going to learn more about this in your first day of class. Blueprint encompasses the following general topics, and you'll see this tagging in your schedule in 145: cell biology, molecular biology, histology, embryology, metabolism, including the favorites carb, lipid, nucleotide, and amino acids, genetics, pharmacology, radiology, and principles of clinical medicine. Now, we love mechanism in Blueprint. We love pathways in Blueprint. But we faculty know that while these are so interesting to us, patients are where the clinical relevance lies. And so I make it a point as your system director to bring in a lot of patients who have experience with diseases and disorders of the pathways that you're going to be studying featured in Human Blueprint. So you're going to have many opportunities to ask many questions of these patients from day 1. In-class sessions are typically, not always, but typically in the morning hours before noon. PCM is typically in the afternoon, and your on-hand sessions as well. Of note, please check your 145 schedule on a regular basis because things can change, and they do change on a regular basis. So you'll want to check 145 and any announcements in Blackboard to make sure you're in the right place at the right time. Okay, so there's going to be a lot of information to be covered in Human Blueprint. With that in mind, how do we faculty and system leadership organize the content of this course? So this course is designed, and all of your courses that you're going to be getting in the next 18 months are designed to teach what we would call big picture concepts. And I want you to think about these like rocks. And the supporting facts, they're like gravel and sand. And your education, your ability to start to learn as a clinician is dependent upon fitting all of this knowledge, all of this information into a jar, your didactic jar. And our aim is to have you fill your didactic jar with rocks, big pictures. You'll want to do that first. Start to understand big picture. And then you put the gravel and the sand into that jar to give you the most complete preclinical education. And this is going to help you to become a great clinician. In a nutshell, if you fill your jar with gravel and sand, just rotely memorize things without understanding their application or why they're important for your clinical practice, you're not going to have space for your big rocks in this jar in your education. So I'm hoping that you're going to get your bearings here to try to understand that medical school is not necessarily, a human blueprint is not necessarily about memorizing all the facts, but starting to understand and put these facts together into your rocks, into your big picture. So in the context of being an excellent clinician, recognizing trends and symptoms and then being able to refer to an appropriate specialist is a critical skill. This is going to be one of your rocks. And this is because you're never going to be able to memorize everything and know everything at every moment in time. But being able to spot a trend in symptoms within your patient may lead you down a path to get that patient the proper care and to lead you to a diagnosis or to lead you to a proper referral for that patient. So again, a recognition and awareness of the basic science and awareness of trends and symptoms, these are going to end up being your superpowers as a medical student. Another big rock in this course and throughout your 18 months in your preclinical is going to be mechanisms of disease. And so in Human Blueprint, what we're really starting to do here is to get you to understand general mechanisms of disease. And this is going to aid in your design of effective and appropriate treatments. In this system, students are to understand certain genetic hotspots of mutations and disease, as well as key enzymes whose dysfunction drives disease that are prevalent in the clinic, things like diabetes type 1 and 2 and other prevalent conditions that are seen in the clinic. So again, this is one of your big rocks. So what are some of the learning approaches that we use in this system, Human Blueprint? So right off the bat, the first week, we're going to do a series of introductory, get your feet wet kind of sessions. And this is a series called How to Med Student. You're going to get exposed to things like, what's the lecture hall look like? Where's my seat? Who are my classmates? How do I access the content through the Blackboard website? Who are the faculty and who are the educational coordinators? These are the types of low pressure, no graded types of interactions you're going to have in your first week. Now there's going to be a lot of content in these 6 weeks, and we're not going to go through everything in class. This is going to be a new experience to you. You're going to have to direct a lot of your own learning. And this is called self-directed learning, and this is going to be done at your own pace. And you're going to be responsible for identifying weaknesses in your knowledge base and then filling those knowledge gaps in on your own time. And we assist with this by assigning pre-learning for the in-class sessions. You get a choice of a couple of different places to go to learn a little bit more and lay a foundation for the in-class session. But the bulk of your learning is going to be outside of class. And so this may be an unusual and a unique situation for you, a first time that you've been in this situation in your educational career. Now, we do in-class learning, and oftentimes we'll do active sessions like in-class polling with your phone. And this is kind of like a spot check on how am I doing? Am I getting hold of this knowledge? We also do interesting sessions like team-based learning where you're going to be working in a group of 5 to solve not only a quiz, but you're going to be solving casework as well in a group setting. We have several patient conferences in Human Blueprint, and this is often very enriching and very rewarding to our students because they actually get to speak with the patients and start to understand their perspectives now that they've learned more about the mechanism of disease. And then finally, in review sessions sprinkled throughout the entire system, we do some fun things to reactivate knowledge. And that would be things like a genetics escape room that we're designing right now, and also other review sessions that would be things like quiz bowls or a review of USMLE type questions on metabolism. So heads up for these sessions. Your takeaway: why should you care or remember things like biochemistry, metabolism, genetics, or this course as a whole? And what I would say is that as a clinician, you will not have to, nor will you be expected to immediately have all the answers or an expertise in every single topic area. You're not a computer. But if you understand some of these mechanisms of disease and understand the manifestations of that disease, your superpower may end up being able to recognize trends in your patient's symptoms. This will direct the proper treatment, or you can make the referral to the appropriate expert. That's your challenge. Finally, the takeaway from Blueprint: this is going to be hard. We're going to have a lot of content to cover in a very short amount of time. Triage is okay. And just a gentle reminder that not every day, quote, has to count. Some days they're just going to be about making it to the next day. But making it to the next day really counts too. And so with that last bit of sage advice. All right, class of 2028, let's do this. This is thread 1, your first system, Human Blueprint. You've got this.